Okay. So the first question will be, what are your strengths?
I would have to say that my strengths are I'm a team player. I'm always open to hear others' advice on how I can better myself. I like to think that I'm really good at building rapport with others, and I'm like to be organized and have a plan, but I can always be flexible with it.
And then what's your ideal company?
My ideal company would be a company that provides an environment where everyone can work together and use each other to provide the best therapy services for our clients, and a company where clients can be comfortable and somewhere that I can grow in my field to offer clients the best quality that I can get.
And then tell me about a time where you had to give someone difficult feedback. How did you handle it?
So I've been a gymnastics coach for 8 years, and being a coach, I've had parents that want to know why their kid isn't progressing as fast as others. And because parents are really protective over their children, it's really hard having to tell them because they don't have the strength that they need to have so far. So I'd say that was probably one of the most difficult times I've had to give difficult feedback. And even though I was nervous, I tried to point out all the good things about their daughters, but I was trying to be as informative as possible.
And then if you were at a business lunch and you ordered a rare steak and they brought it to you well done, what would you do?
I think I would inform the waiter, but I would probably just keep it because there may be other problems going on in the kitchen that I don't know about, and I don't want to stress her out more.
And then if I were to give you the salary you requested, but let you write your job description for the next year, what would it say?
Ooh. I think that my job description would say I'll provide the best quality therapy to all my clients who come into the facility. It would state that I'll present EBP to the family when doing family care plans to support my reasoning. I think it would also say that I'll complete assessments and evaluations in a timely manner and have reports ready to go as soon as possible so I can begin therapy promptly. And then billing and notes would be completed in a very timely manner.
Nice. And then what was the salary that you're seeking?
I would like a salary around $60,000.
Excellent. Okay. And the next question would be, how do you want to improve yourself in the next year?
I think I want to become more confident in myself and my abilities as an SLP. I want to be able to go into therapy sessions and family care plans with 100% confidence that I can provide my clients with like the highest quality. And then that way I can build relationships with them so we can see progress together.
Excellent. And then if I were to ask your last supervisor to provide you with additional training or exposure, what would she suggest?
My last placement was in an elementary school. So I think maybe more exposure to apraxia clients. I always seem to need more guidance with those students. And then probably additional training in like report writing for the schools and the billing for Medicaid.
And then how long will it take you to make a significant contribution?
I don't think it'll take long, like maybe under a month. I like to make a great first impression with people I work with, And I like to stay in close contact with them so we can work together to get things done.
Nice. And then, if selected for this position, can you describe your strategy for the first 90 days?
I think my strategy for the first 90 days would be to definitely try to get in the hang of things and how the company runs. And then if I need help, I would ask either my coworkers or supervisors. And then I would like to make a plan to complete all my tasks in like a timely manner, and definitely seek help when I'm unsure to make sure I don't make bigger mistakes.
Very nice. So a little bit more about yourself. Why did you choose your major?
My little brother is special needs. And so growing up, I always went to all of his different therapies with him. And I remember how awesome it was for us to see his speech progression, because when he began to talk and be able to like express his needs to us, it completely changed our lives because we weren't constantly having to guess what he wanted or what he needed. And I think that I just want to be able to make that impact on others' families the way that his SLPs impacted our family.
Wow. Thank you for sharing that. That actually is a great story. And then what would you do if you won the lottery?
If I won the lottery, I think the first thing I would do would be pay off the house my husband and I just bought. So we don't have to keep paying on that. And then I would probably pay off his vehicle and my parents' vehicles. And then if I had money left, I would probably go on a trip overseas to Rome, and then send my parents somewhere that they want to go because they've always been my biggest supporters.
Well, very nice. And then if you were an animal, which one would you want to be?
I would be a lion. I've always had a thing for lions because they're known for their like strength and their courage, and I think that they're just really cool.
Very nice. And then last question. If you could get rid of any one of the U.S. states, which one would you want to get rid of and why?
That's so hard. I would probably get rid of like a small state that wouldn't really matter if it was gone. So like maybe New Jersey. I don't know if anything important comes from there.
Well, very good. All right.
Okay. Let me pull up the question.
You're going to be a tough act to follow.
Okay. Where would you like to be in your career 5 years from now?
5 years from now, I would like to be in an outpatient clinic working with adults. And I would really like the opportunity to do like a speak out program or LSVT to provide those services too. I'm very interested in voice therapy.
Very cool. What would you consider are your strengths?
I am a very determined individual. I always have been. I used to play select soccer up until college. I was the captain of that team, and I became the club president of the soccer team at my university. I have always been very caring. I just really try to do my best for others and try to help everyone in any way I can. And if I don't know an answer, I make it a mission to find the answer to provide people with the information that they need.
Very nice. Can you describe a time when your work was criticized?
Yes, I can. Um, I was informing a patient's caregiver about, I was trying to describe what aphasia is and to give it in a non-jargon way. And my supervisor pulled me aside after and just let me know that I wasn't being very like user friendly or just like talking with like normal language to actually explain what it was. I was using way too many like technical terms, and it wasn't helpful for the caregiver. And that was hard for me to take that. But after that, I changed the way I deliver, how to like explain different things, like for example, an individual with aphasia. And I noticed after I switched how I gave my answer to them that they started asking me more questions about it. So I definitely noticed a difference after being told.
It's definitely hard not to use like technical terms.
It really is. So that was kind of like surprising for me, but I definitely benefited for that being pointed out to me that I was doing that.
Okay, if I were your supervisor and asked you to do something that you disagreed with, what would you do?
If I disagreed with something, let's say treatment-wise, you suggest that I do something else, but I feel like there's a better treatment route, I would show evidence-based practice, and I would show different things supporting my side if I feel that the patient would benefit from a different treatment program. But I would definitely discuss it with you before conducting it. And then I am also one that is very gracious. If there is better evidence for your approach, I would do that.
All right. What salary are you seeking?
So for the St. Louis area, an entry-level position is roughly around $48,000, and I would like to receive that amount just due to my schooling and my experience in this area.
Okay. If I were to give you that salary, but let you write your job description for the next year, what would it say?
It would say that I would provide the best care for the patient using evidence-based practice. I would conduct the assessments required for the patients within the appropriate billing period. I will provide caregiver education regarding patients' plan of care. I will provide staff education for if the patients need additional support to meet their activities of daily living. I will try to be the best team member that I can be for the group and provide anyone with additional information if needed and appropriate for patients' care.
Good. Okay. How would you go about establishing your credibility quickly with the team?
I would try to make the best impression I could, and I would definitely watch to see how everyone interacts with one another. But if like a situation were to come up where I would need to step up right away to support the patient, that's the number one thing for me. I just would look at each patient, and if they have any questions that I could answer to make the quality of life better for the patient, I will do so.
Okay, good answer. What do you see yourself doing within the first 30 days of this job?
I will be doing everything to support the patients. I will be conducting assessments, evaluations, screenings, providing quality therapy, and just trying to make sure that if anyone needs help, like my coworkers need some questions answered, that I can provide them with the proper response.
Good. How do you want to improve yourself within the next year?
I would like to receive additional training, as I mentioned earlier, with LSBT or Speak Out. I would really like to gain more experience in the voice field, and I also would like to take more CEUs regarding dysphagia trainings. I feel like those areas are really fascinating to me, so I would like to gain additional experience.
Okay. And if I were to ask your last supervisor to provide you additional training or exposure, what would she suggest?
She would suggest knowing more about billing. I definitely need to learn more about coding so that I can bill quicker for patients whenever I'm writing up eval reports and treatment codes. Would definitely be a training course that I would benefit a lot from.
Agree. What is your personal mission statement?
My goal in life is to just help as many people as I can, and just to provide them with a smile, like a happy face to see. The world is just full of a lot of negativity, and if I can do one kind act for someone, I would like to do so.
I love that. Okay, why did you choose your major?
Well, that actually is a fun story. In high school, I was really unsure what I wanted to do. I first thought about teaching, and my boyfriend's mother is actually a speech language pathologist. So she suggested going to her work one day to job shadow. And I was like, okay, I'm open. I just would like to experience different things. So she was working at a skilled nursing center. And the first patient that I ever job shadowed was having a modified barium swallow done. And I thought that was the coolest thing I've ever seen in my entire life. And I immediately was like, okay, I'm signing up for classes. This is what I'm going to do. And then I found out later that it's actually bigger than modified barium swallows, and you can actually work with children and things. And I'm like, wow. So I fell into it, and I just fell in love with it. It's so many options, and I really like that ability to expand and go different ways with it.
That's awesome. Okay. If you were an animal, which one would you want to be?
I would like to be a golden retriever, so a dog. And I say that because my friends used to compare me to one because I loved sports and I liked being very active and running around. And like I said earlier, I just like making people happy. But I think I would still like to be a golden retriever because just like they just are man's best friend and they want to be with people, and I do too.
That's a good one. Okay, if you could get rid of any one of the U.S. states, which one would you get rid of and why?
I would get rid of Illinois, my own state, because there's a lot of disagreement between Chicago and Southern Illinois, but most of the population is in Chicago. So a lot of things are not equally distributed. So I think this would probably be the best state to rearrange or to get rid of entirely.